It's kind of funny how some of our most complex systems, like healthcare, can sometimes end up failing the very people they're supposed to help. It usually happens when all the experts are working in their own little bubbles, right? And patients can just fall through the cracks. Well, today we're looking at how one hospital system saw that exact problem and just completely flipped the script. All right, let's get into it.
So, to really get a sense of the challenge here, you got to start with this number, 8 to 10 million. That's how many Americans are suffering from just one type of vascular disease, peripheral artery disease. It's a huge, complicated problem. And the old way of treating it involved this dizzying maze of specialists who, frankly, weren't always on the same page.
So here's how we're going to break down this incredible story. We're going to start with the problem, what we're calling a fragmented system. Then we'll look at the radical new plan they came up with. We'll see how they actually built this collaborative model from the ground up. And then, my favorite part, we'll get to the mind-blowing results. And finally, we'll talk about what this could mean for the future of medicine as a whole.
Okay, so first up, let's set the scene. We're heading back to Ohio, to the time before 2017. At the University Hospital System, if you had a serious vascular problem, your journey through their hospitals was, well, let's just say it was complicated. Your care was completely siloed. The source material actually uses a really powerful word to describe how things were. Contentious. See, this fragmented care wasn't just inefficient. It was actually creating friction between doctors. Think of it like trying to build a house, but the plumber, the electrician, and the carpenter refuse to talk to each other. The whole focus shifts from building the best possible house to just protecting your own little piece of the project. And the patient was getting lost in the middle of it all.
And this slide, wow, it just lays out the consequences perfectly. Specialists were basically stuck in their own towers. The kind of care you got really depended on which doctor you happened to see first. It led to wasted money, inconsistent results, and a total nightmare trying to cover emergencies. But it all boiled down to one simple, brutal fact. The system was designed around the needs of the doctors, not the needs of the patients.
But then, in late 2017, they just decided enough is enough. Instead of trying to put a Band-Aid on this broken system, they made a really bold choice. To tear it down and design something totally new, right from scratch, with a radical new vision at its core.
And this was their new mission statement. It's so simple but so powerful. They wanted to build a single, unified program that wasn't defined by which department you were in or what building you worked in. Nope, it was defined by one simple question. What is best for this patient? This was a massive shift from being doctor-centric to being truly patient-centric. So how do you make something like this happen? Well, you start at the top. They built a leadership team with heads from different specialties, all forced to work together. But here's the real genius move, the thing that changed the whole game. They created what they called a specialty-agnostic financial dashboard. This meant that profit and loss weren't tracked by department anymore, but for the entire center. That move single-handedly erased the financial competition that makes doctors protective of their own turf. For the first time, everybody's success was tied to the same goal.
Okay, so they've got the new leadership and this new financial structure in place. Now came the hard part, actually putting this philosophy into practice and changing how doctors work together every single day.
They started by creating these incredible interdisciplinary teams. Think of them like medical super teams. For really complex problems like trying to save a limb from amputation or treating a deadly pulmonary embolism, they built dedicated teams that brought all the right experts to the table right from the start. No more bouncing a patient from one specialist silo to another. And they didn't just stop there. They basically wove this collaborative DNA into every single part of their work. Case reviews weren't just for surgeons anymore. Everyone was in the room. Young doctors in training had to rotate through different specialties to really understand what everyone else does. They even changed how they hired people. Every new doctor was interviewed by a panel of different specialists to make sure they'd actually fit into this new team culture. So, they rebuilt this whole model from the ground up. And yeah, it sounds great in theory, but did it actually work? Well, the results weren't just positive. They were, and I'm not exaggerating here, absolutely staggering. Let's just start with the results from that limb salvage team. The source says it right here. Their new way of working led to a 75% reduction in major amputations across their entire system. I mean, just stop and think about that for a second. That's not a statistic. That's hundreds of people who got to keep their limbs, their mobility, their quality of life.
75%. I mean, that's the power of collaboration right there.
But the impact didn't stop there, not by a long shot. By working together and sharing resources, like using cardiac cath labs for procedures that used to be done in way more expensive operating rooms, they became unbelievably efficient. The number of procedures they could perform just exploded. It quadrupled in only 6 years. And of course, a four-fold increase in procedures means a massive increase in the number of patients they could actually help. This wasn't just about being more efficient with their money. It was about expanding their reach and giving top-notch care to way more people in their community than they ever could before.
Seriously? The wins just kept piling up. Patients got appointments faster, the shared on-call schedule meant doctors were less burned out, and morale went way up. And by standardizing everything across the whole system, they made sure every single patient got the same high level of care no matter which hospital they walked into. So what does all this mean? The story of this one vascular center in Ohio isn't just a feel-good local story. It's a potential blueprint for the future of how we treat complex diseases everywhere.
What they stumbled upon was this amazing virtuous cycle. When you put the patient at the absolute center of everything you do, everything else just gets better. Better care leads to happier patients and happier doctors. That attracts the best talent, which then leads to even better, truly best-in-class results.
And that leaves us with this final, really critical question. This model of breaking down silos and focusing on the patient worked wonders for vascular disease. So just imagine, what if we applied this same thinking to cancer care, or to neurology, or to any other complex field of medicine? If this is what's possible in one area, what could the future of healthcare really look like if we did this everywhere?